What's up, you guys? Today we will be talking about pneumonia. So pneumonia, there are different types for pneumonia. It could be bacterial, it could be viral, like the COVID-19. It could be pulmonary abscess. It could be bronchitis. So let's talk about the bacterial pneumonia. Bacterial pneumonia, there are different types for bacterial pneumonia. It could be community acquired pneumonia. And how do we treat that? We treat that with ceftriaxone plus azithromycin. But if penicillin allergy, moxifloxacin. Only if penicillin allergy. That's only because it causes antibiotic resistance, and we don't want that. The other ouch, what happened? The other with the bacterial pneumonia, it could be hospital community acquired pneumonia, HCAP, which is hospital acquired. So a hospital acquired, usually we treat it with vancomycin plus peptazo. Peptazo usually for Pseudomonas, because that's what we're worried about in the hospital, and vancomycin usually for MRSA. Okay, so but then we could add Cipro if they're so sick. We could add Cipro to that. Okay, but what if it is not really community acquired, not really CAP, not really community acquired pneumonia? What do we call that? We call it atypical because it's caused by smaller organisms, so it doesn't cause the typical symptoms. It's not like the bacterial community. None of the big organism cause more problems. So this one, we just do PO azithromycin, oral azithromycin, or PO doxycycline. Okay, or you can even do amoxicillin. This is the atypical pneumonia. The other thing is that for a viral pneumonia, what do we expect usually? Viral could be a flu. Usual pneumonia, how does it present? Usually fever and a cough. Let's see. Fever plus cough. That's the typical presentation. For viral, could be caused by a flu. It's associated with fever, myalgia. It could cause encephalopathy. Okay, so or it could be caused by COVID-19. COVID-19 usually it is a single-stranded positive RNA virus. It causes acute virus. It's just like Ebola and West Nile virus. It's hard to treat, and the problem is it's the same. It's called, by the way, the name of the virus is called SARS-2, and that's the one that causes the COVID-19. Is the name of the disease. We usually treat the acute respiratory distress syndrome, not the virus. We treat the acute respiratory distress syndrome, not the virus. The problem with this virus, usually with the other viruses that causes rhinosinusitis, it grows at the 36 body temperature, but this one grows at the body temperature, grows at 38. So that's the problem with the virus, because it grows at this temperature. That's why it causes problem. There are other viruses like it, but it doesn't grow as a body temperature, so that's why it's not as problematic. So that's the thing. Another thing, if it's a pleural abscess, pulmonary abscess. How do we treat it? What's the difference? Usually we find cavitary, lesion, air fluid level. Then we add clindamycin, anaerobic coverage, or ampicillin sulbactam. And just watch out for, could be TB, could be a fungal infection. That's one thing important to look for. And the other thing we want to talk about too, like I didn't mention, bacterial, usually on x-ray you will find consolidation or infiltrate, that's what you see. And for viral, usually interstitial. That's why it's annoying, because it affects the interstitium. Interstitial pneumonia, so that's why it's dangerous. Okay. The bronchitis, usually it's not a viral. Usually after a viral infection, it's not caused by a microbe or anything like that, so it's not pneumonia. No need for antibiotics. No need for antibiotics. Okay, so there are indexes that you can do for pneumonia. Indexes, let's put that here. The indexes, usually we have an emergency department. They usually curb 65, which is C for confusion, U for uremia, more than the B1 more than 12, R for respiratory rate more than 30, B for blood pressure less than 90, 65 for age for 65. Internal medicine doctor usually use other criteria. It's called, they want to see, they call it life of stay. Just want to see how many days they can stay. So you see hypoxemia resolution, that's what you want to focus on. And then you want to know the duration of antibiotics. Is it 3 or 5 days? What is it? Then role of resolution, determine the duration. So the resolution determine the duration. So the faster it resolve, the faster they recover. Okay. In general, what do we do in general? In general management, usually ambulate early. Try to ambulate them. You can do advanced diet, and if you find sepsis, you gotta try to lower the fever, give them something for the fever, defeverance. You do hypoxemia, may linger, that could cause that. If it could worse, with sepsis could worse the hypoxemia. And you look at the progress, monitor progress. If there's a relapse, then you do re-image with CT scan. CT scan. You look for pleural effusion in this case, or empyema, or cancer for these situations. Okay. So that's basically the summary of a management of a pneumonia. Okay. So for just to review, recap, if it's a bacterial, community acquired, ceftriaxone, azithromycin. If it's hospital acquired, Vanco, Peptazo. If it's not really CAB, just oral azithromycin. If it's a viral, you treat the acute respiratory distress like the COVID-19. If it's a pulmonary abscess, you add anaerobic coverage like clindamycin or ampicillin sulbactam. Bronchitis, no treatment. Indexes in the emergency department, they use curb 65, and the internal medicine doctor, they just want to know the life of stay, look at the resolution rate, and for how long do they want to give them antibiotics. And in general, if you try to ambulate them early, give them food, and if there's sepsis, you lower the fever, you monitor the hypoxemia, see their progress. If there's a relapse, you do CT scan to look for pleural effusion and Peyman cancer. And that is the management of pneumonia.